Good day to everybody, and welcome to the webinar. My name is Mark Maloney. I'm the CEO of VenOps. VenOps is a specialized compliance company that does automated OIG exclusion screening for hundreds of medical practices. It's a mandatory compliance, and we make it very easy. We are in partnership with the Medical Association of Georgia as the sponsors for Indie Practice Presents, a series of webinars designed to help independent medical practices produce more revenue, save money, and protect themselves from outside risk.
The video you are watching is of a patient being checked out of a common EMR system. What's truly remarkable about this video is that it's not a human that's performing this task. These clicks and the other steps necessary to check out this patient are being handled by a new artificial intelligence called Tempida. Tempida is visually aware and can actually see the screen to move the mouse to the proper locations to perform its tasks. This particular demo is on a Cerner EMR and is being run at a slower than normal speed so that you can see Tempida work. But Tempida can be trained to work on any EMR to free physicians of repetitive, cumbersome tasks, allowing them to be more efficient. Tempida can even handle clinical note generation. But how does all this work? Let's start at the beginning with a demo of how Tempida generates the clinical note. The Tempida note generator works with any EMR system and is accessed by a simple web browser. So to access your templates, you simply go to tempida.com and log in. Once you log in, you'll be presented with this Tempida editor in your web browser. The problem with templates in many EMR systems is that the templates are not intelligent. They can't handle complex clinical scenarios. For example, even on a common problem like carpal tunnel syndrome, there's a lot of variability. Variables such as how long the patients have had symptoms, what kind of treatment they've had, and my clinical plan make static templates useless. As a result, most physicians still choose to dictate their note, which is an incredible waste of their time. To open a note for the patient, you simply click on the open. And Tempida are divided into two sections separated by the red line. The upper portion, called the header, is where you'll make your selections for a particular patient. The lower portion, called the body, is where Tempida's AI will automatically generate the note for you based off of the selections. So for example, on this patient, I simply have to select which in the selections at the top, the Tempida AI is automatically changing the text at the bottom to reflect these selections. So for example, since my plan right now is surgery, you'll see that under the assessment of plan, it reflects that I will be doing surgery on this patient. But if I change my plan from doing surgery to doing an injection, I simply make that selection and the Tempida AI automatically changes the text for me. So even complex clinical notes like this take only a few seconds due to the power of Tempida's AI. So once I generate the note in the Tempida documentation system, how does it get into my EMR? That's really simple. I simply click one key on my keyboard and the Tempida Autopilot AI takes over. You'll click the preview button to copy that note to the clipboard and then sign my orders that I've already pre-selected. Then it will go into the visit summary and create a visit summary for this patient. Sign that visit summary. And then it will go in and create a new note for this patient. And then it'll paste the text that we've already created in the Tempida documentation system into the new note. All of this happens automatically without me having to be at the computer. I could simply go on and see my next patient. The AI is finished generating this office note and finished checking out this patient. Tempida can handle any type of text-based notes, including op notes. So for example, if I'm doing a total knee on a patient, I'll simply open the template, make the selections at the top, like the side that I'm doing and the size of the components that I'm using. And then Tempida's AI generates the entire note for me. If I click the preview button, This gives me a preview of what this note will look like, but also copies this entire text onto the clipboard, which can then be pasted by the Tempida Autopilot application into the EMR. I've been using the Tempida system in my practice for over a year and has increased my revenue generation by 30%. This is because I spend less time documenting and doing mundane tasks and more time actually seeing patients and diagnosing and treating them. Since Tempida is completely cloud-based, any templates that anybody wants to make publicly available are available for any other physician in the system. Since your templates won't be locked into an EMR system, even if you decide to move practices or you work at multiple locations that are on different EMR systems, your templates are always available for you via the cloud. For more information, please go to tempida.com to sign up for a free account or see more features. Thank you.
Well, thanks a lot, Dr. Tipernini. That was amazing. The 30% increase in productivity is certainly phenomenal. So our next presenter, before I leave that subject, like I said, if anybody's interested in a conversation with the architect and developer, Dr. Kishore Tipernini, let me know. Just email me at info@venops.com. So our next service or product is Revenue Cycle Management by iMagnum. Our presenter is Kasi Kalyanaraman, and I will now turn over my screen. First, I'll turn off my video and my screen, and I will turn the screen over to Kasi. Give me just 1 minute. Kind of like when we had the interruption by Siri, sometimes live webinars have unexpected issues. Kasi, I believe now you have the control of the screen.
Yes,
And
Mark.
I
Thank
see your
you.
presentation. Please proceed.
Thank you. Okay, very good afternoon, everyone. My name is Kasi Raman, Kasi in short. I represent iMagnum Healthcare. So we are actually thrilled to introduce iMagnum Healthcare, a leader with over 20 years of expertise in delivering tailored revenue cycle management services. We have partnered with 300 plus physicians. We have crafted 4 proprietary products, and our dedicated team ensures seamless solution across the entire RCM spectrum. Today, we would like to explore with you all how our extensive experience and commitment to innovation address the evolving challenges on revenue leakage in the healthcare RCM industry. Moving on to the next slide, let's unveil the challenges that define our daily healthcare landscape, and more importantly, witness how we reshape this narrative. Consider this: 1 in 7 claims faces denial, totaling a staggering of 107 billion industry-wide denials. Surprisingly, 87% of these preventable denials slip through the cracks during resubmission. Now enter the intricate aspect of prior authorization, where denial rates range from 10 to 41%, with an average of 12.5%. Shortage of staff takes the stage, with 64% of RCM positions vacant, contributing to a 15 to 20% spike in AR over than 90 days. Turning to the delicate art of timely claim addressal, a striking 30% are left in the shadows, costing $181 per claim to complete a appeal. These challenges, though formidable, become our canvas for innovation. So we welcome you and join us on this journey as we paint a vibrant solution, turning complexity into clarity and uncertainty into a new narrative of success. So what is that we typically do as part of this free practice end-to-end RCM analysis? As we embark on transforming your RCM challenges into triumphs, our approach is rooted in simplicity and transparency. No frills, no hidden agendas, just a straightforward commitment to excellence. The excitement begins with a seamless engagement process featuring no strings attached, no fees are inclusive. Just join us by signing a non-disclosure agreement and a business associate agreement. From there, we start to deep dive into the core of our partnership, the complementary practice analysis audit. So what is that we typically do? We take your source report to perform a practice or analysis where we take the outstanding aging report and we start developing multiple slicing and dicing of the data, and we start arriving at patterns that causes the major setback. When we say patterns, we talk about patterns that involves pairs, procedure codes, diagnosis code, aging buckets. If there is a practice that services in multiple locations, then we talk about location-wise analysis and provider-wise analysis as well. So this entire practice on audit does not only talk about the denial piece of the section. It talks about the end-to-end revenue cycle, where the front, middle, and the back portion of the entire revenue cycle is taken care of. Where in the front, we talk about the patient registration, and then we talk about insurance verification coding, and we talk about payment posting rejection analysis, and then finally the denial management and insurance AR and patient AR related analysis. So this is one aspect of our approach. If I were to go deep dive, as I explained in the previous slide, in each of these segments of revenue cycle, we give you a detailed overview in terms of where all you have challenges, from a patient registration, insurance verification, coding, denial management, AR management, most importantly, credentialing and enrollment. And one big section of our analysis is to do a complete health check of your workflow to identify what are the efficiency aspects that needs to be improved. Basically, we do an evaluation of your efficiency from an RCM workflow perspective, identify bottlenecks, and most importantly, we provide solutions in terms of streamlining those processes as well. So it goes beyond a routine check. Our practice analysis audit is a comprehensive journey through every aspect of your revenue cycle management, from outstanding aging reports to intricate patterns affecting your bottom line, and we leave no stone unturned. Our approach is going to be meticulous. We develop multiple perspectives by slicing and dicing your data, and we provide all of these information, which is going to be a complementary thing, and it's completely free. And it's an end-to-end RCM analysis, a diagnostic tool designed to reveal the nuances that impact your revenue. So join hands with us and let's decode the language of your financial health together. So while you might be interested to understand these analyses, it's also critical for you to know how these analyses as transcribed into some numbers. So that's where I'm going to walk you through on the next slide, where for a client, from a success story standpoint, from this practice audit analysis, we figured out that a denial rates from 18% was dropped to 5%. And we were able to increase the revenue by 19%. And we were able to reduce their AR greater than 90 days by almost 1.5 million. And most interestingly, our AR days got reduced from 78 days to 54 days. Basically, we are talking about almost 24 days of reduction or 24 days of increase at the rate of getting the money from the payers. So that's a significant jump that we are trying to do, or that we have done for our existing clients in the past. In addition to that, as part of our analysis, we also recommend you some technology implementation, and we also provide you some industry benchmarking solutions. So what is that? What's the technology implementation that we are talking about? by implementing our RevShield AI, which is an artificial intelligence and machine learning algorithm tool, workflow tool, we were able to increase or reduce almost 48% of claims that needs to be followed up manually. So typically we're talking about 48% of claims automation, and we were able to reduce the cost by at least 25% for our existing clients. And that was through a 35% of productivity improvement. And two important aspects that we were able to significantly automate is 40% of prior authorization automation and 75% of benefits and eligibility related automation. We had not had a single claim that was missed from a timely filing issue aspect, and every claim was assured to be followed up every 30 days once. So that's a guarantee that we provide. And this is all based on the existing clients on ambulatory business, where we have processed more than 100,000 transactions per month for a period of 13 months. So that's a quick recap in terms of our a deep, insightful practice audit analysis. These results are more than mere statistics. They are a testament to our unwavering commitment to your success. As we unveil the remarkable outcomes of our practice audit analysis, it is not just numbers. It's about transforming challenges into triumphs. The efficiencies gained, cost reduced, and revenue increased are echoes of our commitment to your success. So just imagine the possibilities when innovation meets dedication. At iMagnum, we don't just offer solutions, but we create opportunities for growth and prosperity. So at this forum, we invite you to be part of this transformative journey. Let's collaborate to redefine the future of revenue cycle management. Your success story begins with a simple step of just engaging with iMagnum for a free practice audit analysis. So now the floor is yours. Questions, thoughts, we are here to hear them, and feel free to share, and let's explore the possibilities of working together. Thank you. Thank you for being part of today's session, and we look forward to the exciting chapters that lie ahead. Thank you. Thank you, Mark, and thank you, everybody.